everybody for being here today. This is our 6th webinar for the Upstate Entrepreneur Ecosystem. Our first 4 focused on more tactical, where are we information about loans and lending, and then about employees and taxes and accounting. And then we had a great one last week with Elizabeth Freeman from USC Upstate, who's an industrial occupational psychologist, to talk about just the mental health, emotional piece, and how to get ourselves healthy from that perspective. And then now we're going to be looking forward with Scott Baier here from Clemson. He is chair of the Department of Economics over there. But he's going to talk to us about kind of, what are the economics of this situation and what do we need to be looking at going forward so that we can not only make better decisions for ourselves, but help our clients and the entrepreneurs and businesses that we work with to make better decisions too. But something about Scott that I thought was extra interesting is that he teaches as 2 classes that he teaches. One is causes and consequences of the financial crisis, and then economic growth theory and applications. So we figure there's probably a class coming up soon, causes and consequences of the COVID-19 crisis. And so, we're glad to be part of that learning that he's doing as he's thinking strategically and about what lessons are to be learned from this. So welcome again to other folks who have signed on recently. We have some administrative things that I always like to go through. First of which is that please ask questions through the chat function. If you aren't familiar with the chat function, if you take your cursor and shake it around the bottom of your screen, you'll see a couple of icons come up, and there's one that's a little talk bubble that says chat. If you click on that, you'll see a box come up and just type in your question. It should be, preferably your question should be to everyone. Dean Hebel monitors that, and then we'll ask your questions for you at the end of Scott's presentation. But please feel free to ask any questions at any time. And before we get started with the questions, I am going to ask you to practice with the chat function by introducing yourself to everyone. And the question that we want to ask y'all today is whether or not you're going to do any shopping or eating out. Now that things are starting to open up, just kind of let us know, yes, I can't wait to eat out, or yes, I can't wait to shop in my favorite store, or I might wait just a little bit longer, or I'm still going to order out. Just kind of let us know, because it's helpful for all of us to get a feel for what's happening and how other people are approaching the situation. But let's see, next week is going to be our final webinar. We are going to have a roundtable discussion or an opportunity for all of us to talk to each other. And it's mainly going to be about what we're learning, but also what are we going to need to know going forward? What are the resources that we're finding that we cannot find? What do we wish that we had? And all of this is in preparation for our quarterly meeting, which is going to be changed from, I think it was Tuesday, the 12th of May, now to Thursday, June 25th. Hopefully we'll all be able to get together at that point. And as you know, it's a big enough room that we can all physically distance from each other. So if you could be thinking about for next week, and I'm going to get with Justine and have her send out some kind of thought questions for y'all to be prepared to discuss next week. All right, and then that will be it until June. So I am going to be sure to thank our sponsors. We have Ogletree Deacons, Trejo Corporation, Furman, and Intellinet. They all make this possible, and we appreciate all that they do for 10 at the top and for our group. All right, I see some things happening on the chat, so that's great. Thanks to all of you, and please don't forget to introduce yourself, answer the question. Are you going to eat out? Are you going to go shopping now that you can? And then ask your questions in it too. All right, so I am ready to turn it over to Scott. Scott, are you ready?
I am.
All right. Well, good. And you will see Scott's slides up as well. Thanks, everyone.
All right. Well, again, thank you for taking time out of your day to listen to this. And how this talk is going to go through, I'm just an economist, so I'm going to take a 30,000-foot view, so to speak, of what we're seeing with economic activity, kind of how things have unfolded in the past, what I think is going to happen in the future, and then talk about how monetary and fiscal policy have responded to the shock. So I should say one thing, to start, I was fortunate, I guess, in a way, to be working in the Bush administration in 2007 at the White House as an economist there. So I was there for the financial crisis back in 2007, 2008. And so what is really, to me, is strikingly different about this, there are several things, but one thing I think is important to note is how quickly this has unfolded compared to, say, the financial crisis. Remember, the financial crisis began in August of 2007, and then there were fits and starts where the financial crisis would flare up, and then the economy would move along kind of as normal. Then you had Bear Stearns, and then later in the year you had Lehman, then you had TARP, the General Motors bailout, and all that played out over a course of almost 2 full years. Here we've had something really play out, and now we're just starting the 5th month of that. So what I'm going to do is kind of say where we're at right now.
Scott, somehow or another you got muted.
There, I must have, now am I unmuted? I think I'm unmuted again.
Yeah, you are.
Sorry about that. So I guess, unlike a lot of data that we're seeing, on TV with respect to the number of confirmed cases and the number of deaths, GDP data and economic data doesn't come at us as quickly or get released as quickly. And so just last week, we had the first kind of evidence of how COVID-19 was impacting the economy. So what we could see here is in the last quarter, or quarter one of 2020, GDP contracted at a rate of about 5% over the course, over that quarter. And again, this is an annualized rate, so that number actually looks bigger than what it is. But again, it's important to see what happened here is that in this last quarter, both consumption and investment shrunk dramatically. And a key thing about these data about the first quarter is that the economic impact of COVID-19 probably only impacted the last 2 to 3 weeks of the first quarter, the last 3 weeks of March. So it had a noticeable and large impact on the first quarter GDP. The next quarter GDP is just gonna be off the charts, awful in terms of what it looks like. But we think if things go well by the 3rd and 4th quarter, things will start to pick up again. Somewhat interesting about this number, though consumption contracted a little bit over about 6% last quarter, one of the biggest components of the contraction of consumption was the consumption of healthcare services. And this is almost counterintuitive because we think of the coronavirus or COVID-19 being a health shock, but yet we had a big reduction in the consumption of healthcare services. And this was likely because we stopped doing other procedures, hospitals stopped doing other procedures. We had dentist office and hospital visits all shut down. So there was a big reduction in healthcare services last quarter. Another data set that comes at us a little bit more frequently are the weekly unemployment claims. And I'm sure you guys have seen this or paid attention to this. These data come out weekly. It's one of the few data series that gives us a measure of what economic activity is like on a weekly basis. Normally, we don't pay much attention to it, but again, that COVID-19 happened so quickly. This is one of the things that we focused on right away. So again, during kind of normal times, weekly unemployment claims for unemployment insurance hover around 240 to 300,000. And of course, what you could see and what we would expect to see is that during recessionary periods, these weekly unemployment claims spike up. So you could see during the Great Recession, the highest unemployment claim was 665,000. You also see similar spikes in the 01-02 recession, the 91-92 recession. Again, notice what's key here is the dates I only have depicted here. From January 1990 up until March 14th of 2020. Again, during the Great Recession, that was the biggest spike that we had up until the last couple of weeks, in which the unemployment claims were 665,000. The last 5 weeks is what you could see from this graph is literally what we've done is we've made molehills out of those mountains. Now I'm redepicting this graph, just adding in the last 6 weeks actually, and unemployment claims over the last 6 weeks have been average roughly 5 million. So if you look at the last 6 weeks of data, we've had over 6 million new claims for unemployment insurance. Again, so it dwarfs anything that we've ever seen in the past. And so if you add these up, you have 30 million unemployed out of about 160 million labor force. So you're talking about unemployment probably on Friday when the next unemployment figures get announced, we'll probably have unemployment hovering about 13 to 14%. There was a study last week done by the Economic Policy Institute arguing that these claims for unemployment insurance are likely to understate unemployment by quite a bit, that 9% of the people who applied were rejected, 22% of the people who were trying to get unemployment insurance couldn't even get through, and 11% said they didn't even try because they thought it was too difficult. So if you add in all of these factors of how big do we think unemployment may actually be now, there may be as many as 40 million US workers that are unemployed. So again, take that out of 160 million labor force and you're talking about an unemployment rate that's close to 25%. So again, think about where we're at now and what the policies are like going forward, and what economic outlook is going to be going forward. It's useful to go back and take a look at kind of how this all evolved. And again, this gives us a sense of how quickly things evolved, say, from the very start. So it wasn't until December 31st of this year where the first case was detected in the Hubei province. It wasn't until January 20th that we had a case outside of China, Thailand, Japan, South Korea, and at the time, in the US at the time. On January 31st, the White House limited international travel. So that was the first kind of action that the US took. On February 9th, the death toll in mainland China exceeded that of SARS. And then a few days later, the WHO named the coronavirus COVID-19. At that point, it was just, it was an emergency situation. It wasn't declared a pandemic till about 2 weeks later. So again, at this point, most people, most economists, most politicians believe that the coronavirus would largely be contained within a few countries. And so I was up in DC for the National Association of Business Economics Conference at the end of January, and there was hardly any talk at that point about how COVID-19 would impact the economy. So there was a little discussion, but it wasn't viewed that it would have a large impact on the US economy, because up until that point, it was mostly believed that the coronavirus was likely to be contained within a few countries, mostly China and a few Asian countries. Therefore, it was likely to only impact supply chains. And again, how we see this is that, you know, lots of US manufacturing relies on supply chains and outsourcing and offshore outsourcing through China. So roughly 30% of China's GDP is from manufacturing, and that's connected to around the world. So if you kind of add this up, China's outsourcing with the rest of the world would have ripple effects on the rest of the economy and probably slow down GDP in all the other countries. Again, if it was just limited to supply chains, it likely impact these 9 countries or so. And if you add up the GDP of these 9 countries, they account for roughly 60% of world GDP. So again, in early February, late January, most economists and most politicians thought that, well, if COVID-19 is just limited to impacting supply chains, it would knock off about a quarter to a half a percentage point of GDP, knocking GDP growth down from 2.5% this year down to 2%. Now, as we know, it wasn't limited to just the US, and the best way to show how it impacted the US in some sense in real time is using, rather than a timeline, looking at the S&P 500 and the Dow Jones. So what I did here is I initialized the beginning of the year Dow Jones and S&P 500 to 100, and then we can see movements from there are represent percentage differences from where we started at the beginning of the year. Kind of the first shot across the bow of COVID impacting the US economy in a large way was on February 24th. 2 things came in. There were a week retail sales report, and then there was a report that COVID-19 cases in the US were likely to be larger than were anticipated. And this led to the biggest fall in the Dow Jones Industrial Average in 2 years. A few weeks later, it was reported that COVID-19 cases exceeded 500. This was on March 9th, and there was another rapid drop in the Dow Jones and S&P on that day. Perhaps the wake-up call for COVID-19 in the US, if we didn't realize it was going to have a large impact on the US economy at this point in time, came on March 13th or March 12th, and this was the day after President Trump had a press conference that evening. That same evening, the NBA postponed many of its games. The next day, the NCAA canceled games, and the Major League Baseball pushed back the start of its season. Again, not what this was an indication of, that large events that had lots of people gathering were all going to be postponed, and then how people interacted in the marketplace was going to be significantly different after that. So again, that was a large drop, and I think that was really the day when everyone began to, in some sense, begin to think that it was really going to have an impact on the U.S. economy. The next day was, and again, this was one of the bounce ups, was the White House and Congress independently began discussing fiscal policy and how it would roll out, and the market responded in a positive way. And really, since this date, the market has been more or less on an upward trend while moving a little bit sideways over the last few days. Again, we've still been on this roller coaster of good news, bad news, and ups and downs in the marketplace. But again, these first couple weeks really were an indication of how COVID-19 was going to impact the economy. And so what we've heard all along, and trying to put this in economic terms and how economists thought about it, is now we're all familiar with terms that we never used before, but now come up almost part of our everyday language, and that's the notion of flattening the curve. And again, what was the idea of flattening the curve? Was if we didn't do anything in terms of social distancing, since we didn't have any vaccines or prophylaxis at the time, the only way we could stop the spread of the disease was by social distancing. And then by social distancing, we may not be decreasing the total number of cases, we're just spreading them out over time. And the key thing about that was, if we spread out the number of cases over time, we would, again, potentially lower the mortality rate. Why? Because there's a healthcare capacity associated with the economy, with the current economic situation. And if the number of cases exceeded the healthcare capacity in terms of IC units, ventilators, doctors, and nurses, the mortality rate would likely rise. So if we spread out the curve or flatten the curve, you would probably lower the mortality rate. But economists also at the same time said, not only do we have the benefit of spreading things out, you're pushing the peak of the hump out later, roughly 2 months later. What else does this allow? This allows for an endogenous response of the healthcare system to say mobilize and say increase the healthcare capacity by converting, say, hotels into bedrooms, or excuse me, hotels into medical beds, having doctors and nurses move in, shipping in ventilators, and so that this could be addressed. So what we do is we could raise the healthcare capacity of the economy. So there are really two benefits, I think, that economists talked about were flattening the curve, was not overwhelming the healthcare capacity, but second, allowing the healthcare capacity to respond to this, what I'll refer to as a health shock. But also on the economic side, we also want to, there is this issue of flattening the curve may also deepen and lengthen the recession. So not only now we just have the number of cases represented kind of on the, in the upper axis, where you have if we did nothing versus social distancing. Now on, in the negative side, you could see I'm having this, the bottom axis here is the GDP, what would be happening in terms of recession. Now, many economists argued that if you didn't do anything and kind of let things play out, you would probably have a deep recession, but it may end relatively quickly. That recession may be accompanied by a lots of loss of life, but we would move through that and we'd come out on the other side. In some ways, it'd be something like a V-shaped type recovery. However, with the practice of social distancing, what you were likely to see was a much deeper recession coming from the outset and potentially a much slower recovery. So what we could potentially have from the aspect of social distancing is we don't overwhelm the healthcare capacity, but we end up with a much deeper and potentially a much longer recession. So why is that? If you go back to these countries I had listed before, and you look at the share of their GDP that's associated with services, you see the US has roughly 80% of its GDP is associated with the consumption of services. And it's the case that most services rely on people interacting in the marketplace. So when you practice social distancing, what you're going to do is disrupt the delivery of services, generally reducing GDP. So the most vulnerable industries that we thought at the time would include entertainment, food, recreation, health, beauty, education, social assistance, and manufacturing. Why? Because manufacturing relies on plenty of services to help make it go. And so when you look at these industries, they account for roughly 50% of GDP. So again, the big impact that we thought was going to occur was going to be from the reduction of social services. And I refer to it in the header of this slide as a sudden demand stop. On the other side, when I started the talk saying, well, there was going to be supply side effects from disruption of supply side on supply chains. Now what we're seeing, and again, I'm going to show a graph that highlights this, is there was a sudden stop in demand where individuals stopped consuming a lot of these services. And there are a couple of graphs I think I can show that highlight what occurred relatively early on. So this graph represents the percent change in hours worked in several different industries. And it compares how individuals were working in that industry back in January and February when the economy, we believe the economy was doing fine and everything was going along well. So what you can see in this graph is that in certain industries, say beauty and healthcare, home entertainment, hours worked fell dramatically in the first few weeks of March. That within, say, 2 weeks, the consumption of entertainment, the consumption of beauty and personal care, and many other service hours worked in all those industries fell by more than 50%. A key thing that what we worry about as economists, or what economists talk about, and I think in some ways it's a good thing, and we can have a discussion about this, is notice that most of these reductions in hours worked came before any state implemented shelter in place or as a public policy social distancing. Again, what we saw early on was people say, look, there's a health shock out there. I'm going to be more cautious, and they began social distancing on their own. The actions of the government layered on top of that and probably reduced it even further. But again, individuals in the economy kind of took in that information and began social distancing right away. So as we open things back up, it's not clear, and we could talk, it's not clear how quickly people will run back to certain industries, how quickly people will go back to gyms, how quickly people will go to concerts, events. You know, that's not certain. We want to open things up slowly and kind of measure people's response coming back to things. Again, we could also look at, when we aggregate across businesses, we could look at what's happened to percent change hours worked by states. So here I've diagrammed or represented some states, kind of South Carolina and around us. So you see Florida, South Carolina, North Carolina, and Georgia. And again, the pattern of the data looks relatively the same. Beginning at about the middle of March, March 14th, within about, within 2 weeks, there was a reduction of almost 60% of hours worked in these industries as captured by these states. And these states are also representative, I think, of what the nation looked like as well. So again, what we see is this sudden drop in demand in a lot of services that individuals were consuming. And again, this also is to depict the idea that individuals were beginning to social distance on their own before shelter-in-place regulations were put in place by states. So each of these lines represents a state. The dark line is the median, kind of the middle state, or think of it as the average in kind of crude terms. And what's depicted here is the date in which you had shelter-in-place implemented. And what we see, these are open table reservations. Usually a day or two before or a week before the shelter in place mandates were put in place by governments, individuals on their own had stopped going out to restaurants. In some cases, up to 73% fall in terms of where you were going to restaurants even before shelter in place. So again, the idea is people were worried about this health shock and taking it into their own mental calculus even before the government said or state government said shelter in place. Other areas in which we've seen a dramatic drop, that is data is now coming out. So the last month's retail sales, we see a dramatic drop in retail sales. Probably you guys have seen this more dramatically than I have. I only have the 30,000 foot view. You guys have your feet on the ground seeing this come in. But again, these more and more of the data that we see come in have this same picture that's like a marble falling off the end of the table. Things look like they were doing well, and then we had a sudden drop. Similar with automobile and light sales trucks. You can see here I drew in a line that's at about 11.5 trillion. Usually anytime you dip below 11.5 trillion, the economy heads into a recession. Again, we look like we were doing okay at the start of the year, but there was a sudden and dramatic drop in auto and light truck sales, again, pushing us down to 11.4. This is a common leading indicator of where the economy is going. So again, when we observed these numbers coming in and seeing such a dramatic drop, we knew the economy was heading into trouble. So, going back to the same group of countries, now I've depicted here confirmed cases, and the number of deaths in the U.S. is by and large, by a wide range now, the leader. Of course, the U.S. has, with the exception of China, a much bigger population, but you can see this is data as of this morning. We have almost 1.25 million cases and over 70,000 deaths. The last column here depicts where the IMF now forecasts real GDP to be for the entire year of 2020. And they see the US is predicted to contract at about 6%, Canada minus 6.2%, Italy 9%, Spain 8%. The only one who is expected to have positive growth is China. But China has been growing about 8 or 9% a year. So 1.2% growth for them is a dramatic reduction as well. So here's this question I think that people keep bringing up is there some type of trade-off? And well, obviously there is. There is a trade-off between, in some sense, GDP growth and the number of confirmed cases. And so economists have a long history of doing cost-benefit analysis, that is looking at these trade-offs. And so we could think of, and economists have done that, and I'll give you a quick back-of-the-envelope calculation of a bottom line of what I think many economists would believe. If we had no containment policies, what would occur? We would have reduced economic activity. We would have more coronavirus deaths. And then there would be, of course, some non-coronavirus deaths that are avoidable. If you had stringent containment policies, you would dramatically reduce economic activity. You would have fewer coronavirus deaths, and you would probably also then increase the number of non-coronavirus deaths because people with lower income who also may have health issues may, again, may die, or people may commit suicide. Suicide rates may increase when unemployment, we know what that occurs when unemployment gets very high. So again, you also have a potential increase in non-coronavirus deaths. So we have to do some type of comparison of what's going to happen with no containment policies and what's going to happen with stringent containment policies. And you know, this isn't a world, and this is a world with no real good choices. You're choosing between really two bad alternatives. And you have to make apples to apples comparison. And so this can be uncomfortable to make these comparisons. We still have to come up with ways which make some sense to make apples to apples comparisons. So again, what we want to do is make a comparison of reduced economic activity versus the value of additional lives saved or additional deaths. So it's a complicated equation. Ways we do this, both numerically and philosophically. So in order to do this, we have to, economists put a value per life. We call it the value of a statistical life. So that way, when we talk about a reduction in economic activity, that's going to be in dollar terms. We're also putting loss of life in dollar terms as well. So you can see why philosophically, in some sense, maybe morally, people may not like it. But again, it's a way to make some comparisons. So a quick back of the envelope calculation, the value of a statistical life that economists come up ranges somewhere between 7 million and 14 million. I'm going to pick a number on the low end, say 7 million. And the number of lives saved, there was an estimated range if we had no containment policy, roughly between 600,000 people would die to up to 2 million. Again, I'll pick a number on the low range. So using these two numbers, we could see that by social distancing, we're saving 600,000 lives at 7 million a life. That's roughly 4.2 trillion. In addition, we know that we believe that COVID can have some long-term health issues for survivors. And if we think there are 2 million survivors and we have attribute that healthcare implications, whether from additional medical procedures or loss of ability to do work or leisure activities at 500,000, that's another 1 trillion off. So if you look at the total benefit from social distancing, economists will come up with a range of, kind of on a low end, of about $5.2 trillion for this quarter. If you look at the cost of sheltering in place or of lockdowns, we also have a way of measuring the value of each day of work, because over the course of a year, we have non-work days, and that varies across years. So we could have put a value on what looks like a lockdown. And if you look at the number of lost work days this quarter, plus add in the numbers for March, the cost of a lockdown is roughly $1.3 trillion. So, most economists would do this type of back of the envelope calculation and say, at least for this quarter, the benefit, say, of sheltering in place of 5.2 trillion exceeds the cost of the lockdown or the sheltering in place of 1.3 trillion. And again, this shows up in a poll by University of Chicago experts. So the University of Chicago Economics Department surveys leading economists and asks them questions all the time. One came up and said, one of the questions was, is a comprehensive policy response to coronavirus would involve tolerating a very large contraction in economic activity until the spread of infections has dropped significantly. And you can see overwhelmingly the response by the economists was yes, that the benefits of sheltering in place in terms of lives saved for this quarter, we're going to exceed potentially the economic cost of sheltering in place. So most economists were in favor of some notion of social distancing and shelter in place policies. So another interesting thing I depict here is there seems to be a very strong relationship between the number of confirmed cases and state GDP. So again, state GDP blends two things, income per person and population. And what you see here, this one variable explains about 80% of the variation of number of confirmed cases across states. Again, why is that? You would think a state like New York, in which people are interacting in the marketplace all the time with a very large population, are going to have much higher instances of coronavirus than, say, a smaller state like Vermont or South Dakota. And this data seems pretty consistent with that. You don't want to be above, I drew in this line here, that's a line that's kind of the best fit. It says with every 1.1% increase in state GDP, confirmed cases go up by 1.25%. You don't want to be above the line. That means you're doing worse. So obviously there we see New Jersey and New York. You want to be below the line. That means you're doing better. California, Texas, and Florida are doing pretty well. And you could actually see South Carolina is right here. I don't know if you could see my mouse, but South Carolina sits kind of a little bit below the line, as South Carolina is doing relatively well given the size of their GDP. So again, now I'm going to move on and talk about the government response. I'm going to break it into two components, the fiscal and the monetary side. The way we should think about this economic shock, it's a health shock that has externalities that have macroeconomic consequences. We shouldn't think about this shock like how is often debated. Is it Keynesian type of shock or a classical, in terms of Keynesian solutions versus classical solutions? I mean, words I will never say in talking about monetary and fiscal policy in this sense are stimulus package, because normally when we think of stimulus packages, what we mean is you're trying to stimulate the economy, get people to go out and spend money. And that's the exact opposite of what we're trying to do now. What we're trying to do now is just to provide income support, income maintenance for both households and firms so that they can, again, continue to operate as close to normal as they can before. We're really not trying to get people to run out to the store or even run online, well, maybe run online, but not go out and spend in a physical sense. So the response that most economists have argued should be targeted at the cause of the problem and should target income support for individuals and financial support for firms. Again, the cause of the problem is COVID-19 and its contagion. The solution is social distancing and to provide income support. And so the key thing about this instance here is this economic shock isn't structural in the sense going into the start of the year, the economy looked very good. In some sense, it was a Goldilocks economy that we had reasonable economic GDP growth. We had very low unemployment and low inflation, kind of the best of all worlds. And again, unemployment was low. So what we're hoping is, since there was nothing structural before this health issue occurred, we can get to the other side. And what we want to do is implement policies that preserve employer-employment matches. And I'm going to talk in more detail about that. So again, the responses by the fiscal side, I'll go through briefly. Again, they respond to the impacted sector, the health crisis, provide income support for lower income and most vulnerable, provide support to maintain employer-employee matches, and provide some support for sectors that were most exposed to the shock. So one of the things that economists argued or thought should have happened almost back at the outset, back in early March, was this idea of maintaining employer-employee matches, that again, the economy was running well up until that point. And so what we've seen is the fiscal policy as it's rolled out, there have been specific provisions that have tried to maintain employment at least the best they could. So here's a quick look at the timeline of fiscal policy. On March 6th was a small expenditures of $8.3 billion. It's funny that we could say $8.3 billion is small. On March 14th, we rolled out the Family First Act. This was really designed to impact the health side. Then I would say we have phase 3A and 3B on March 18th and April 24th. And again, this was trying to address some of the economic issues with the Paycheck Protection Program, impacting medium-sized firms, and again, additional benefits for households. So again, to go through this real briefly, so the Family First plan really was to address kind of the health shock. What they offered was free testing for anyone whose doctors recommended testing. Also to expand family and medical leave and paid emergency sick leaves. Again, the idea here was they were worried that families that maybe from lower income or more modest means, someone in their household or themselves would be sick, and they would feel like they needed to go to work in order to maintain their income. So what they would do would they go to work anyhow, effectively spreading the disease. So what this plan did, or the Family First plan, was making sure those people who were sick were tested. Those people who had someone in the household that was sick were able to stay home by giving them the medical sick leaves and the additional unemployment benefits. And again, also bolstering food assistance through SNAP and home delivery and nutritional assistance. So clearly that was designed to hit the health side. So you could see, let me go back here if this works, that this blue bar represents the fraction of households that have paid sick leaves. And you can see by income category, those in the lowest 10% of income, only 30% of those individuals have some form of paid sick leaves. And then the lowest 25% income quartile, you'll see that only about 40% of those families had some type of paid sick leave. So again, the Family First was directed at the health shock, making sure to impact those that were most vulnerable to being sick and potentially making sure they get the care. The next act was we rolled out was the CARES Act was the direct payment to households of $1,200 for every adult and $500 for every child. The small business loans, so the Paycheck Protection Program, started out at $350 billion. So it was designed at for employees of less than 500. So I'm looking down at my phone because I just got some numbers in before this started that I put together, that roughly 74% of these Paycheck Protection Programs were loans of $150,000 or less. And they really were designed for small businesses in terms of employment counts. If you look at employees that had less than 9 businesses in just certain counts, not dollar values, this was about 78 to 80% of the Paycheck Protection Program went to relatively small firms from that 1 to 9 workers. The next part, the Economic Stabilization Program, was the Main Street Lending Program, which again was $500 billion for medium-sized firms, state and local municipalities, and then again to protect some of the industries that were adversely impacted. If I was going to guess what would be the next thing that was going to be happening on the fiscal side, on the federal side, would be more support for state and local municipalities. Last week, California had to ask the federal government for additional funds because they're having issues meeting some of their bills coming in. So again, the next fiscal act I would expect to see would be an extension of funds paid to state and local municipalities. And then they expanded unemployment benefits both in terms of size and length of the unemployment benefits. And again, here's some of the major recipients of the Paycheck Protection Program, the PPP program. You could see that it went to construction, again, to many of these services we talked about: professional, technical, scientific services, manufacturing, healthcare, accommodation, retail, and wholesale trade. Altogether, these 7 industries account for roughly 75% of the PPP loans that have gone out. The Federal Reserve timeline was again, really a lot of it was rolled out in the middle of March. And rather than going through the timeline of what they did, I'm going to put it in buckets, I think, of what the Federal Reserve did and why what the Federal Reserve did is different than what it normally does, and even different than what it did during the Great Recession. So kind of the common things that the Federal Reserve always does during times of economic crisis, it works to lower the federal funds rate. It allows more discount window lending. That is, it opens up to borrowers to come in and lend from the Fed. It also lowered the reserve requirements. And again, it uses forward guidance, something that was honed during the Great Recession, to tell the markets, these are what short-term interest rates are now, and this is what we would like longer-term interest rates to be over the foreseeable future. So these are all standard things that the Fed does during times of crisis. And when they first began to implement these, they began to work. They were working kind of what we would expect to see. So during a time of crisis, U.S. Treasuries are safe havens. So people want to hold U.S. Treasuries. It's a safe asset. This increase in the demand for U.S. Treasuries typically bids up the price of Treasuries. And if you had an intermediate or a macro class or a finance class, we know that bond prices and interest rates are inversely related. So as there's this increase in the demand for bonds, it was actually pushing down the interest rates. But by the middle of March, what we noticed was, but by the middle of March, what we see here is this increase again in interest rates. The Fed realized what was going out was basically what I'll refer to in a slide or two as a cash grab. That no longer was it the case people wanted to hold Treasuries. There was a demand for cash, and people were selling Treasuries, pushing the price down, raising interest rates back up. So this is where the Fed shifted in to its, what I would say, its Great Recession mode. It opened up a lot of the same programs that were implemented during the Great Recession. It announced on March 15th, it didn't call it quantitative easing, but effectively it was. It was going to increase securities purchases of both mortgages and in terms of Treasuries at all different maturities in order to provide liquidity to the market. It relaunched its primary dealer facility credit, opening up the window to investment banks, making sure investment banks had access to liquidities. Money market mutual funds again seized up. Interest rates started to spike in this market. The Fed stepped in and said, we're going to, again, provide liquidity to the money market mutual funds. And then in the overnight lending market with banks, they increased both the magnitude and the duration in which they were willing to lend to banks in the repo market. So again, the second thing the Fed did, or second action the Fed did, was to ensure financial market stability by providing as much liquidity as they could, not only by quantitative easing in the repo market, but also to investment banks and through the money market mutual funds. Now, the thing that it's done differently, so what you could see here again is that graph. You have that run to safety, that cash grab that I talked before, then all these additional actions the Fed did providing liquidity to the market seemed to begin to work about the end of March. And again, the Fed has been very active. The third kind of bucket I would put the Fed's action in is to support corporations and businesses. And this is something that the Fed has never done in the past. It now is effectively lending directly to businesses and services. So it created the primary market corporate credit facility, and it allows Feds to lend directly to corporations. So if a corporation issues a new bond, the Fed can go into that primary market now and buy the bond, again, effectively lending directly to business. It instituted the commercial paper funding facility. So many of the entrepreneurs may have some familiarity with the commercial paper market. What the Fed noticed here was that the short-term borrowing and lending was seizing up, and interest rates were spiking in this market as well. So the Fed instituted this, saying we're going to be a buyer in the commercial paper market, again, lending effectively to firms, and that began in the middle of March. The Main Street Loan Facility, this is the program working through the CARES Act. This is designed for medium-sized businesses with revenues up to $2.5 billion. They began that on April 9th. And then the Paycheck Protection Program. facility as they're working with, again, through the Treasury in order to facilitate making loans to small businesses. So again, what we're witnessing here is something new that the Federal Reserve has never done in the past. That is lending directly, in some sense, to businesses. So where are we going forward? If you look at growth projections for 2020, almost all major forecasters of the economy have us growing at close to -6%. The Congressional Budget Office, the IMF, and Moody's all put us close to -6%. Morningstar is kind of has the rosier outlook of -3%, and Wells Fargo is at -5%. Good news is most of these same forecasters project that the following year growth will tick back up between 4 to 5%. So again, most people believe that if we can address the health shock that has come up with vaccines or some type of treatments, that we can put the fears behind us, that the economy, since it was in a good spot before we went into the recession, will come out on the other side. So people have often asked me, what type of, is this going to be a V shape, a W shape, an L shape? What letter is this recovery going to be? My guess is it's going to look more like that, look like a Nike swoosh, a deep drop and kind of a slow rebound. And I think that how quickly rebound is going to depend on, one, how we address the health shock, and then two, how comfortable people are in terms of going back out to the marketplace. So, unemployment projections, I'll just kind of skip this one. You tune in Friday, we'll know. Right now, I believe the unemployment rate is probably going to be, I'll update these numbers, the unemployment rate is probably somewhere between 12 and 15%. Friday before 9, the numbers will come out. We'll also hear the number of jobs lost. It'll be numbers that we have not seen in our lifetimes and probably not in our grandparents' lifetimes as well. It's just going to be a number that's well off the chart. Another question comes up is the federal budget implications, and we're basically blowing the budget out of the water. Going into the year, we were expected to run a deficit of 1.1 trillion. Now it's looking closer to be 4 trillion. It'll most likely go down next year, but again, depending on how quickly we can move things. So the deficit this year may be as high as 20% of GDP. What does that do to the overall debt? It's going to push us from where we thought we were going to be at about 81% to over 100%. Again, the key here and the big concern here is the U.S. economy, in terms of its federal debt and deficit, wasn't on good standing to begin with. It was an issue that had to be addressed. COVID-19 is just going to move that time window forward. But again, I think most economists would argue that you have to address what's in front of us, and we'll worry about the debt once we get on the other side of the window. So opening the economy back up, and I'll wrap up in 2 minutes. Concerns about opening the economy back up. I think there's real questions that people have about this. Initially, it was we didn't want the healthcare system to be overwhelmed. Now it seems the conversation has moved to we don't open up the economy until COVID-19 is eradicated or eliminated. I think where we need to be is someplace in between. Second question that comes up is how much pent-up demand is out there. Once we start opening up for business, who will come back and to what industries will come back? We won't know until we start opening things up. So again, I think it's going to vary across businesses and across instances. So for a quick example, my dentist called me last week, said our offices are still closed. We're going to have to postpone your teeth cleaning. We hope to open in a couple weeks. I'm in no rush to get my teeth cleaned. I can wait 6 months or a year, but I certainly want my dentist office open in case I need a root canal. So there are some things within a business that I'm certain I want to buy or may need to buy, but there are other things that, we may delay our purchases on. Again, to highlight the idea that the private markets have responded, there's a whole list of things that were canceled even before there were government mandated shutdowns. So this is just a partial list. And again, back to the open table, we could see people were taking those actions. So again, the way to think about this is even when we open things back up, it's not clear who is going to go out and what people are going to do. One thing we're starting to see is that people seem to be getting a little bit frustrated. So these are Apple mobility trends. And you can see initially, again, around that key date in the middle of March, people stopped moving around, but over beginning at the end of March and into April, you can see people's mobility in terms of where we're driving and where we're walking. That's starting to peak up. Obviously, public transit isn't increasing much, but again, you can see some sense people are wanting to get back out and getting a little bit of frustration, get a little bit frustrated by, in some sense, some pent-up demand. Remember, consumers are 67% of GDP, and we can't suppress, in some sense, that consumption forever. Eventually, there is going to be some pent-up demand. So I'll stop at this point and open it up for any questions that people have. Again, you guys have, you're on the ground there seeing more things than I do. So I'll take some questions now for as long as you guys want to stay on. I went a little bit longer than I would have liked. So I appreciate you all for staying on through this talk.
And Scott, thank you. And Aaron, if it's okay, I think we'll do that. We'll stay on for another 5 or 10 minutes for anyone who is able to stay on. We had a few good questions that I think will be of interest. And certainly if you have to drop off, we understand. One question, Scott, deals with kind of diversification that on a micro level, is it possible or likely to see companies try to diversify their product and offerings because of the interruption? And if that happens, do you see that potentially eroding some of the niche markets that have existed historically, especially in the short and the medium term?
Yeah, so again, that gets at the idea that fundamentally the economy was sound coming in. I think coming out, that means there was a fundamental disruption. I think in certain markets, I think it'll never go back. I don't know where the airline industry or industries that move people around quite a bit, what they're going to look like on the other side. You know, with niche markets, I always think that there's going to be niche markets for certain items, and I think, but it is going to rely on people to adjusting to catering to not only the product demands, but potentially the safety demands that people have on the other side of it. If I've stayed to a couple people before, you could imagine Yelp reviews now having a health and safety component to it, and that may be a more informative piece of information that people have going forward when they go out and shop. And as I go into different stores, I can see different stores are responding in different ways to COVID-19.
That makes sense. We've had a couple questions about employment or unemployment, and I'm sure you've heard this as well. Do you think that the fact that the federal unemployment benefit was increased to a point where in some cases it was more money than people were making, while working? Do you think it's at least in the short term incentivized unemployment, and could that prolong that? How long the unemployment rate continues to be high until that benefit goes away?
Yeah, certainly that created a disincentive for some people to want to stay on their job, and it could very well be disruptive. But I think in many ways those would be markets, those would be jobs and potentially industries that had high labor turnover. I think a fair amount of individuals. So some people put that number at about, if you were making less than $50,000 a year, it almost made sense to go on the unemployment insurance. But I think some people who kind of value that employer-employee relationship and realize that there was employment opportunities down the road, say for promotion or advancement, they would be willing to stay on, again, trying to maintain that employer-employee matches. So I think it has a lot to do with what career path that you were in going forward and where you were at. Again, those things will impact people incentives to stay and leave a job. But in those industries that had relatively high labor turnover anyhow, you would probably want to see more of those workers would rather collect the unemployment benefits than stay on.
So I believe the extra federal unemployment is supposed to phase out in June and July, I believe by the end of July. Do you anticipate then that we could see the unemployment rate go down around that same time, or will that depend on some of the things you just mentioned?
I think it's going to depend largely on where we are in terms of addressing the health issues. It's going to depend how much consumers are willing to come back, even with some threats. And again, it depends on, maybe in the middle of June they extend those benefits. That wouldn't be a surprise either. And of course, if they extend the benefits, I wouldn't expect unemployment to bounce back quickly because of that.
Sure. Well, you made a good point, and I thought in your early slides it really illustrated this. This is such a different situation because it is a public health crisis that is now created an economic crisis as opposed to the other way around. So I guess some of the ways we deal with the economic crisis, still obviously is impacted by the public health crisis components.
Yeah, that's right. So the way the jargon that economists would use is the role of fiscal policy here would be to provide some amount of social insurance, right? That when you have this large shock that is systemic, that impacts everybody, no private insurance company would cover systemic or widespread shock. So it's really the government that has to step in and do what it can, and that is, and in this sense, it's provide income support, and I also think provide support for small and medium-sized businesses to stay open. To hope we get to the other side of this as quickly as possible.
Well, and that leads to the next question was about the uncertainty that's really driving a lot of the decisions, and I guess what you're saying is that really the way to mitigate that uncertainty is for the health elements to be addressed. But beyond that, are there any things that can be done, especially for small business, to maybe mitigate some of the concerns around uncertainty outside of the health component?
Well, my view is, and it's again what I've seen is, the government can provide mandates and provide guidelines on when things can open back up, but I just from my shopping experience around the area, there's a lot of heterogeneity across industries and even within industries of what any store looks like and how the businesses are run. I think entrepreneurs are extremely innovative on doing many things, and one of the things I think we'll see emerge from this is new and improved ways to improve the health side of address those health concerns. And again, I think people will know, and by word of mouth and other means, I think it'll spread pretty quickly what stores and what businesses are providing some level of health security, both for employers and employees and for customers. You see it all around us right now. There's some stores I walk into, I say I won't go back into, and there are other stores I feel rather comfortable going back to.
Another component is that we've seen, and it seems to be something that's coming up more and more, is a trend of virus outbreaks in places like food processing plants, in some cases in prisons, in residential sites, and things of that nature. How much of an economic issue is that potentially as part of this, or can that be moderated with the health elements and continuing to do the health compliance?
That would require me to be a little bit more of a disease expert than I am. but you do worry about, and it's been reported more and more in the news in the last few days, you do worry about the supply chains through food. If that gets disrupted, then I think there will be large impacts again, and you're going to expose some of the people, more vulnerable people with lower incomes and more health concerns to issues that would otherwise they would not be exposed to. So my concern would be now with those supply chains being disrupted on the food side.
It seems like, and I really was fascinated by the approach you took to quantify the expense per se of making the choice to do the social distancing and staying in place as opposed to doing nothing, and showing, I believe it was around a $5 trillion impact, I guess in a positive way, for making the choice that was made to social distance as opposed to if we had done nothing. Do you see that number over time? Is that a number that would continue, or is that something that changes as some of these policies that are coming in place kind of changes?
So that's a great question. So it has been changing over time. And one of the slides I dropped, just for as many slides that I have, an important aspect on the epidemiology side of this is what's often referred to as the R0, is that it's how many people the average infected person gives the disease to. So initially the R0 was above between 2.5 and 3. So every infected person would make 2 to 3 other people infected and sick. Now what we're seeing in New York and other places, as we get to the other, in some sense, the other side of that hump-shaped curve, the R0 has fallen down below 1. And that's a good thing. When it gets below 1, that means it eventually dies out. So again, what does that mean? I think when you're talking about, when you're looking down the road next quarter or the quarter after that, the effects of social distancing and other things are pushing the spread of the disease down, so that benefit of social distancing is going to go down, and then potentially the economic costs are going to become much larger, because what was a well-functioning economy now will probably have structural issues coming out on the other side if lots of firms go bankrupt and lots of people are unemployed and many people don't have income for sustenance. So again, I think that was a 1 quarter snapshot. Go off a 2nd quarter, the benefits of social distancing go down, the cost of social distancing go up, and I think each quarter you move on, it's potentially those same factors come into play.
So I'll finish with a question that we also asked Congressman Duncan last week about, and he gave, believe it, surprisingly to me, actually, I thought a great answer in terms of around the cost and how to pay for it, because at some point, and you showed the ballooning of the deficit as this goes on. What the congressman said when asked, how you pay for it, he said it has to be strategic and can't be just kind of what was done a decade ago after the Great Recession, where they tried to just pinpoint and say, okay, everything across the board is cut at X%. That they're going to have to be much more strategic about how to pay and reduce costs as we try to cover the costs from this crisis. Do you think that lessons have been learned from the Great Recession and around how to, once we get out on the other side, to pay for the costs? And what do you see as maybe some ways to address that will be a little bit different than were done after the recession a decade ago?
Well, one, I don't think we learned anything from the Great Recession in terms of fiscal policy. I mean, if you look at the path of the government debt over time, we were on an unsustainable path. And it's almost all defined by growing Social Security and Medicare, Medicaid, those non-discretionary components. What the Great Recession and now COVID-19 did is it was a one-time or one-off increase that just moves the timeline up when we have to do something. So really what we're going to have to do is something across the board that occurs once we get on the other side. And if the economy is healthy enough to just start thinking about these things, no one wants to hear this. It's taxes are going to almost certainly have to rise across all income groups. And spending is going to have to be reduced across almost all spending programs. And sadly enough, it's the non-discretionary spending. So again, people are going to have to take phase in most likely cuts in terms of Social Security and Medicaid. The one thing I hope we learned from this is I think something that we learned coming out of the Great Recession. Coming out of the Great Recession, I think banks were in a better financial position going into this recession than they were in the Great Recession. Part of that was public policy. Part of that was management on the bank side. It's surprising to me that after a 10-year, 12-year run of sustained economic growth, that households, and some of the household side could be explained away, government and firms were in such a fragile state once we hit this this pandemic. And if you go look back through time, we had signals across the bow that a pandemic was coming, whether it was MERS, SARS, or Ebola. And so we're lucky with COVID-19. It spreads relatively easy, but the mortality rate isn't that high. Hopefully coming on the other side, we have better precautions to how to deal with the pandemic, both in terms of financial as well as the health side. But large investments will have to go into both of these, I think, coming on the other side. So I hope we have better plans. Long answer, but I hope it.
No, very, very good. And Scott, thank you so much. And Aaron, I'll turn it back over to you if you want to wrap up. And thanks to everyone who has stayed with us. I know we're running a little bit long, but I think, Scott, thank you again for such great information and for all of your insights. Aaron?
Yes. Good, Scott, thank you. And thanks to all of you for your good questions. Dean, thank you for moderating the questions. And just as a quick snapshot of the questions, your answers to the questions, it looks like approximately two-thirds of you are going to continue to stay home. and about one-third are saying, I'm going for it. So, it's that wait and see that sounds like what's happening most of all. And it's, and I think that continues to make our jobs even harder as we support these entrepreneurs, the startups, the existing Main Street businesses, when the consumers are still not sure about shopping and what to advise them on. But next week, we will be talking about that, talking about steps that we can take, ways that we can help reduce the perception of uncertainty for our customers, for our clients and for the business owners. And thanks to all of you for staying the extra time. Dean, Justine, for making this all organized. And Scott, thanks again. Y'all have a wonderful day.
Thank you.
Bye, thanks.